Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and bringing you Caregiver Coffee today, as I have the last many years. And today we're going to be talking about what you see on your screen, and that's Medicare hospice benefits. And this is a 14, 15-page PDF produced by the Centers for Medicare and Medicaid Services, and I'm going to be going through it hopefully within two videos, or just, yeah, roughly half now and half in the next one. So, and the idea is to just kind of go over some highlights. I won't be sharing the screen the whole time, but I will post a link to it on the Coast Facebook page. We're not able to post links in YouTube yet, but hopefully soon. But it will be in the Facebook feed. So we'll go over this. And I am not a government employee. I'm not a representative of Medicare or the government. I'm just going through this publicly available PDF that will explain the benefits and who's eligible, etc. In here. And I encourage you to go back and certainly read this in detail before you're in a situation where you are interested in hospice. So before we get into that, just a little bit about the caregiver support group that I facilitate. So our little plug that I usually do. We meet on Tuesdays, Tuesday evenings, most Tuesday evenings of the year, except for Fat Tuesday, and if Christmas falls on a Tuesday or Christmas Eve falls on that Tuesday. And we go from 6 p.m. to 7:30 p.m. Central, and we're in person and sometimes we are remote. So the basic pattern of how that works, and I will also recommend that you download our calendar that we publish every 2 months that has specific dates and locations. But the basic pattern is the first Tuesday of the month, we're at the Slidell Activities Senior Center. The second Tuesday of the month, we are on the Zoom platform. You can join us by your landline phone. You can join us by your smartphone, your tablet, your smart tablet, or your computer. The third Tuesday of the month, we're at the Covington Senior Activity Center. The fourth Tuesday of the month, and sometimes the fifth Tuesday of the month when approved, we are back on Zoom. So lots of different options. Some people join us only for in person. Some people only join us for Zoom. And people here and there will join us for both. So in whatever way and method and manner you can join us, it would be awesome. We would love to meet you and benefit from your wisdom, and we'd like to be able to, hopefully offer some wisdom to you from the group. And it's not from me, although I have experience. It's from the expert caregivers that come and contribute to the conversation and the dialogue. So we hope that you will take a chance and join us for that. All right, so let's get into this. I'm going to stop sharing my screen, but I'm going to be jumping to that document. So this is Medicare Hospice Benefits, the official government booklet that will include information on basically, well, more than this, but basically it's who is eligible, what services are included, how to find a hospice provider, and where you can find more information, which is going to be Medicare.gov, basically. All right, remember that this is not an official government video. I'm not a government employee. I'm not saying that you need hospice, but I am a proponent of hospice. I think everybody should be. Many times, and this is a generalization, many times when people go on hospice, um, they should have been on it longer, especially if they pass away days or weeks after they get on hospice. They probably should have been on it sooner than that. But again, that's just a generalization. Everybody's a unique and a case by case situation. So, but what is hospice? Actually, you know what? I think this is going to cover all the questions, and I'll fill in the blanks if anything doesn't in this official booklet. So we'll first start off with talking about the fact that choosing to start hospice can be a very difficult situation. The government hopes that the information in this booklet, support from a doctor and from friends and family, and from a trained hospice care team can help you choose the most appropriate healthcare options if you are terminally ill. So when to choose when that's appropriate. Hospice is a program of care and support for people have a terminally ill or who are terminally ill, have a life-limiting illness or a life expectancy of 6 months or less. If the illness runs its normal course, of course, and their families, um, if you get hospice care, sorry. The focus is on comfort or palliative care, not curative, not curing the illness. Services typically include physical care, counseling, drugs, equipment, and supplies for the terminally ill and related conditions. Specially trained team of professionals and caregivers provides this care for the whole person, and that means physical, emotional, social, and spiritual needs. Care is typically given in the home, but people can receive it in a nursing home, or some hospitals are set up where someone could be on hospice in a hospital. Most commonly, it's in the home. Family caregivers can get support in this program, even though uh, they're not the patient, they can still receive assistance. And hospice is not only for people with cancer. So let's jump to palliative care, which is a more broad term. Palliative care is a part of hospice that focuses on helping people who are terminally ill maintain quality of life. If you are terminally ill, palliative care can address physical, emotional, intellectual, social, spiritual needs, and helps support your independence, your access to information, and ability to make choices about your healthcare. So let me go back to palliative care real quick. So palliative care is a wide spectrum, okay? It can go from birth to what we're talking about here with hospice, which is end of life. So palliative covers the whole lifespan. There are children who have cancer who are receiving palliative care. There, and that is they are also, but they're not on hospice because they are also receiving curative treatments at the same time. So palliative, to palliate, means to provide comfort, to alleviate symptoms that are uncontrolled otherwise. So palliative can cover the whole lifespan. Hospice, here we're talking about an expectancy because of a terminal illness or life-limiting illness, 6 months or less, in the opinion of the physician, because this is prescribed by a physician or provider. Um, let's say your hospice benefit can care for your terminal illness and related conditions. And once you get started on hospice care, original Medicare will cover everything you need related to your illness, even if you remain in a Medicare Advantage plan or other Medicare health plan. After your benefits start, you can get covered for services for conditions not related to your terminal illness. Original Medicare will pay for covered services for any health problems that aren't part of your terminal illness and related conditions. However, you must pay the deductible and co-insurance amounts for all Medicare covered services that you get to treat problems that are not part of your terminal illness and related conditions. That is really important. I think most people don't know about that. Here's a note. If you were in a Medicare Advantage plan before starting hospice and decide to stay in that plan, you can get covered services for any healthcare problems that aren't part of your terminal illness and related conditions. And for more information on hospice, if you're in a Medicare Advantage plan or other Medicare health plan, just go to page 7, which we will here in this book. Note, you can ask your hospice provider for a list of items, services, and drugs that they've determined are not related to your terminal illness and related conditions. This list must include why they made that determination. They are also required to give you this list to your non-hospice providers or Medicare if asked. So that's right off the bat. I think that's really important. Most people don't know about that, being able to have other conditions treated, but having that are not related to terminal illness, but having to cover those. So how hospice works. If you qualify for hospice, um, your family will work with your hospice provider, which you get to choose. It is not assigned to you. You're not forced into that. You get to choose, just like you get to choose your doctor or your physical therapist, etc. Um, if you've joined Medicare Advantage plan before you entered hospice and choose to stay in it, your plan must give you a list of the hospice providers in your area. And you can also there's a phone number here that you can call for information about service providers in your area. You and your family are part of a team that may also include doctors, nurses, and nurse practitioners, counselors, physical therapists. I'm sorry, physical therapy. Yes, physical therapy is on here. Pharmacists, social workers, counselors, speech language pathologists, hospice aides, homemakers, and volunteers. In addition, your hospice nurse and doctor are on call 24/7 to give you and your family support when you're needed. A hospice doctor is part of the medical team. You can choose to include your regular doctor, nurse practitioner, or physician assistant on your team as the attending medical professional. That I was not aware of. Typically, I thought that you had to give up your normal doctor when that is the case. So make sure that when you're interviewing hospice companies, they understand that that is the case. I'll read it again. You can choose to include your regular doctor, a nurse practitioner, or a physician assistant on your medical team as the attending medical professional. Who is eligible? If you have Medicare Part A and you meet the following conditions, you can get hospice care. Your hospice doctor and regular doctor, if you have one, certify that you're terminally ill, that you're expected to live 6 months or less. That's the best definition that they have. You accept comfort care or palliative care instead of care to cure your illness. And third, you sign a statement choosing hospice care instead of other Medicare covered treatments for your terminal illness and related conditions. If you choose hospice care, you have a right to change your mind and get treatments for your terminal illness. So you can change your mind. Those are the three conditions: Medicare Part A and three conditions. Um, and then here's the number again to find a hospice provider. What Medicare covers before you start your hospice care, you can get a one-time only consultation with a hospice medical director or a hospice doctor to talk about your care options and how to manage your pain and symptoms. You can get this one-time consultation even if you decide not to get hospice care. Let's see, once your hospice benefits start, original Medicare will cover everything that you need related to your terminal illness and related conditions, but the care you get must be from a Medicare approved hospice provider. So one note as far as that one-time consultation. So you do not have to go to a hospice company medical director to get that one-time consultation. You can go to, there are in hospitals and clinics, there are palliative medicine doctors who can meet with you. They're just considered a specialist outside of your primary care physician. So sometimes you can go straight to palliative care, or I would recommend you go through your primary care physician. Say I'm interested in speaking with someone in palliative care, really just to kind of make sure that we're doing everything that we can for the symptoms that are happening. So it doesn't mean that the primary care doctor or other specialists are not doing a good job. This is just adding what's known as an extra layer of support when you go see palliative. That's not necessarily hospice. All right. Hospice care is usually given in the home, but it can also be given in an inpatient facility. Um, Depending on your terminal illness, the plan of your care, of your the plan of you the plan of care your hospice team creates can include the services that I mentioned just a moment ago: physical therapy, prescription drugs, counseling, dietary. Something that was not mentioned on there is short-term respite. That could be for a few hours. That could be for even, I think we're going to get to it in here, a week, which is a break for your family members for them to have the person who's on hospice go to an inpatient facility for a week and be cared for while they are getting a brief break, some brief respite. Many people don't know about it or take advantage of it. Oh, here we go, respite care. Okay, and it's just what I said. You can the person on hospice can stay up to 5 days each time so that the caregivers can get respite. You can do it more than once, but only on an occasional basis. So it's not a hard and fast rule, it sounds like. What hospice will not cover, um, when you start hospice, you decided that you no longer want to care, you no longer want care that will cure your terminal illness or yeah, and related conditions, and your doctor has determined that efforts to cure your illness are not working. Once your hospice starts, it will not cover the following, see, 5 bullet points. Treatment intended to cure the illness or related conditions, prescription drugs that are not for your terminal illness or related conditions. Hospice will not cover, this is the third one, third bullet, care from any other provider that wasn't set up by the hospice medical team. So it's still saying here, you can still see a regular doctor if you've chosen them to be your attending medical professional. So again, ask about that when you're interviewing a hospice company. The fourth thing is room and board. Your hospice benefit does not cover room and board. However, if the hospice team determines that you need a short-term inpatient or respite services, they will arrange that. Medicare pays for that. And the fifth thing that hospice will not cover is care that you get as a hospital outpatient, such as an emergency room, care that you get as a hospital inpatient, or ambulance transportation unrelated to your terminal illness or related condition. And let's see. Let's cover this page. This is page 7. This is more information about Medicare Advantage, and then we will stop here and continue in a second video. All right, so hospice care, if you're in a Medicare Advantage plan or Medicare health plan, remember, I'm not reading everything on here, so you want to go back and read the details in here. So once you start getting hospice care, original Medicare will cover everything related to your terminal illness, even if you choose to stay on your Medicare Advantage plan or another Medicare health plan. If you were in Medicaid Advantage plan before hospice, you can stay as long as you continue to pay the Medicare Advantage plan's premiums. If you choose to stay, your plan will also cover any extra services that are medically necessary, such as dental and vision. They will cover services for health problems that are not related to your terminal illness. And see, I'm skipping a bunch of information here, fine details that you're going to want to look at. If your Medicare Advantage plan offers a plan with drug coverage, you're covered by the plan for drugs not related to your terminal illness. If your plan doesn't cover services for out-of-network providers, original Medicare will cover services that are not related to your terminal illness. And for more information, there's a phone number, a Medicare phone number you can ask. You can call them and ask. And lastly, information about Medicare supplement insurance or Medigap policies. If you have a Medigap policy, it will cover your hospice costs for drugs and respite care. Your Medigap policy will also help cover healthcare costs and problems that are not related to your terminal illness or related conditions. Call your Medigap policy or state health insurance assistance program or SHIP for more information. And there's a phone number provided for you there. So lots of information. And we went through it very quickly, within 20 minutes. So I recommend you go back and you look over this and you make sure that you understand and then you also talk to the appropriate professionals, whether it's Medicare and the hospice team that you are interviewing. Because remember, you choose just like you choose other providers, you would choose your hospice provider, and there are many out there in all communities in our state and beyond. So make sure that you're asking, poignant questions, especially if you're interested in keeping your own doctor, your regular doctor, as the attending. That's new to a lot of people, and it's new to me. So that must be a change. But that is what it says. So just make sure that they are aware of that, and you can even show them this. So again, we can't link this yet on YouTube in the description, but we'll make sure that we link it when we post this video to Facebook. So thank you so much for tuning in for this part one on hospice benefits through Medicare, and I look forward to being on your screen for the next one. Thanks and take care.